Hello and welcome to the SleepWeaver Prevent Fit and FAQ video brought to you by Circadians. My name is Matt Anastasi and I'm a registered sleep technologist with over 20 years experience. The CDC and American Academy of Sleep Medicine have cautioned about the possible transmission of COVID-19 during aerosol generating procedures like CPAP. That is why healthcare personnel wear personal protective equipment, PPE, including masks, whenever they are in the environment with a patient using CPAP. In normal cases during this pandemic, facial coverings are strongly recommended. But let's say you're a CPAP user in a multi-generational home and you're looking for a way to reduce the risks to family members residing in the house. What if there were a way for you to don PPE during CPAP therapy? Circadians has found a way to do this with SleepWeaver Prevent, a nasal CPAP mask which uses an integrated KN95 mask to filter exhaled air and provide an additional layer of isolation for CPAP patients with known or suspected respiratory infections. Circadians is offering a new combination filter and CPAP mask to address the following concerns during the COVID-19 public health emergency. Risk to healthcare personnel and visitors from PAP therapy in the clinical space, and risks to bed partners and family members, especially multi-generational families, during in-home PAP therapy. How does Prevent do this? The Prevent starts with the skin-friendly, all-cloth SleepWeaver Nasal 3D mask from Circadians. 3D is the newest mask in the SleepWeaver line, and it contains the Zephyr Seal, seen here in white, which is a fabric membrane like you see in ski clothing, which provides a gentle seal between the skin and the interface. Here you can see that it is between the 3D interface and the tubing elbow connector that a KN95 respirator is integrated to filter exhaled air. Here is the Prevent in person. You can see more clearly how the 3D relates to the KN95 in its connection and covering of the exhalation ports, which in reality are small holes in the fabric located on either side of the 3D CPAP mask. And if I attach it, you can see how they function together, first to treat sleep-related breathing disorders, and also cover the exhalation ports to filter and reduce the particles that would be emitted through the aerosol generating effects of the CPAP machine. This construction allows for the mask to be taken apart for cleaning and reuse by unscrewing the swivel elbow from the threaded connector like so. The 3D mask can be cleaned and reused, but it is approved for single patient use in the hospital or home environment. You clean the 3D CPAP mask by hand washing with a mild, non-abrasive soap and warm water every other day. Never use hot water. Repeat washing until visibly clean and hand wash the headgear weekly. Rinse well with quality drinking water and allow to air dry out of direct sunlight. The 3D portion of the interface is single patient multi-use mask. The KN95, however, which is designed for one night's use, must be replaced each morning, and Circadians offers 10 packs of KN95 masks to install in the same manner shown. Now, as with any CPAP mask interface, the seal of a KN95 is determined by the strap placement, material compliance around the nose and face, and patient facial morphology, which means that there can still be air leakage when the mask isn't tight or well sealed. The way to mitigate this is to prioritize fit. And I'm going to show you a few steps to maximize the seal of both the KN95 interface and the respirator sections. First, fold the KN95 back to expose the 3D nasal mask. Next, attach the headgear and center the nasal cushion right over the middle of the nose. Now the white Zephyr seal, the soft cloth portion, should go all the way around the end of the nose and cover the nares. 4 straps should be equally adhered to, but not tight. Check that there is a finger width underneath each of them. Now you're ready to turn on the pressure. To achieve a good seal, position your index and thumb on either side to raise, lower, and move the cushion. Also move it side to side until you notice a reduction in S leak. We call this shimmying. Do this until there is no detectable air coming out the sides of the mask. If you are getting leak into the eyes, you will know it. One final step to address leak into the eyes is to pinch the top of the white membrane and allow it to fill up with air, and then release it to get a good seal. With this 3D now sealed, you can fold the KN95 back to its original shape and loop it over the ears the way you would any other respirator. There you have it, SleepWeaver Prevent.